Chula Radio Plus presents Chula Innovations Unlocked.
Did you know that 1 out of every 100 senior Thai citizens aged over 60 is a Parkinson's disease patient? That is around 150,000. And at the global level, that number is estimated to be around 10 million around the world. But the researchers at the Excellence Center for Parkinson's Disease and Related Disorders, Chulalongkorn Memorial Hospital, have developed the tremor-reducing Parkinson's gloves, an innovation which automatically reduces tremors, allowing Parkinson's patients to enjoy social life and reducing side effects from medication as well as risks from brain surgery. In this episode of Chula Innovations Unlocked, we talk to Assistant Professor Onanong Phokaewvarangkul, one of the key players in developing this innovation. Dr. Onanong, thank you and welcome to Chula Innovations Unlocked. We meet again, and thank you for inviting us into your home, your house, or whatever it is, but it doesn't have a roof. Where exactly are we?
Thank you. And this is our home modifications clinic. This is a center for Parkinson's disease, as the name as the Chulalongkorn, the Center of Excellence for Parkinson's disease and related disorder. So our center is targeted to treating patients with Parkinson's disease and movement disorder. And this room, we know that most of the Parkinson's disease people might have the problem with the mobility. And if they have the good home, good house or environment, that may be helpful.
Suitable for them.
Yes, that's right.
Okay, but today's topic is about the Parkinson glove right here in front of us, right?
Yeah,
Before we go into the details of this innovation, my first question will be, what would be the biggest challenge for people who are diagnosed with Parkinson's disease?
In my opinion, for the biggest challenge is for the treatment for the Parkinson's disease patients, because we know that there are like 4 symptoms that people with Parkinson's disease are usually face it and might interfere to their daily of activity. The first thing is for the slowness. The second thing is for the stiffness. The third thing is for the shaking. And the fourth thing is about the postural instability or the poor balance. Yes.
Body balance.
Yeah, that's right. And we found that these kinds of things, many people, they might have the problems because at this time, some of the medication that we use to treat Parkinson's disease at this time, they quite have a good response to treat some of the symptoms, but not all symptoms.
Right. Do they come in like packs of 4? You always have to have all 4 symptoms once you have Parkinson's?
Mostly people might have like at least 2 or 3 symptoms, and some of them might be up to 4 symptoms or maybe more than 4 symptoms. At this time, we found that the oral medication, especially with the levodopa, this is one type of the medication, they will give the good response to the patient with Parkinson's disease. But by the way, the effect of the levodopa is good only for the slowness and the stiffness, but not too much for the shakings.
Not much for the tremor.
Not too much for the tremor. So that's why many of Parkinson's disease who have the tremor, they might have the problem because even though they get the good response with the other symptom, but shaking is still there.
Before this came about, in order to eradicate the shaking problems or the tremors, what are the options?
In the past, that if patients still have the refractory to the treatment, that just oral medications alone is not good enough. Sometimes we need to add more and more oral medications, and patients might have the problem from the side effect from the oral medications. And in case for patients who have a very severe of the tremor that might limit them to do some activity of daily living, we might consider for the brain surgery. Yeah, the brain surgery or and implanting some of the device that have the potential to stimulate some of the brain nuclei in the brain that might be helpful to lower the Parkinsonian symptom. But I would ask you, if you would you like to do the brain surgery?
I'd rather just shake if I could choose.
Because many people they're quite afraid about the treatment with the surgery.
I see. So how does this Parkinson glove help with the pain points, and how did this idea come about in the first place?
Because in the past, most of the treatment that we provided for Parkinson's disease, especially for the oral medications and for the brain surgery, usually target at the brain, at the central tremor mechanism.
Okay.
So if I go back into the pathophysiology of the tremor in Parkinson's disease have the originates from the two center.
Okay.
The first center in the brain, because the brain have the brain structure, the nuclei that have propensity to originate of the tremor.
Okay.
And the second source that can produce for the tremor as well in the body is a peripheral mechanism that have the muscles, nerves, and also with the reflex loop.
Right.
And we found that these both two centers usually originate for the tremor of the Parkinson's disease patients.
Okay.
But by the way, in the past, most of the treatment, for example, the oral medication and brain surgery, usually target to treat in the central mechanisms only. So that's why I think that the peripheral mechanism is just another point that we can be consider.
So it's like another channel.
Yeah, another channel to treat. And they didn't have not too much of study to explore this area.
Okay.
Not too much. So that's why this might be another option, another channel that we can target in this.
Right. So how does the mechanic work?
Actually, the starting, this is very funny because as we are the movement disorder specialists, we know that Parkinson's disease patient, especially for those who have the tremor dominant Parkinson's disease, they usually have the shakings or the tremor and the hands mainly, and the tremor usually occurs at first on the one side of the body.
Okay.
And the shaking usually comes at a slow frequency shaking like this.
Okay.
But once patient using the hand to do something, for example, to do posture, to grab something, to use the hand to do something, we found that shaking usually gone away.
Right.
So that's why we try to mimic the functions of the hand motion, of the action hand motions by using the electrical muscle stimulations. And we found some hypotheses and also with the evidence support that using the electrical muscle stimulations to stimulate the hand muscle or the forearm muscle might be helpful to lower the tremor as well.
So basically, we're kind of mildly electrocuting them.
Yeah, that's
in
right.
a way.
Yeah,
but at a safe level.
Yeah, that's right.
Right.
Yeah, that's right. And also, this kind of the stimulations, we have a theory. It might be have some connections to the control to help partially to help or to reduce the shakings in the central mechanism. Sorry, but they have some limitation of the studies about it. But in our pilot some study about using the electrical muscle stimulation, we found that using of the EMS might be helpful to lower the tremor at this time.
Now, as of mid 2023, as we're filming this episode, you've had 5 versions of the Parkinson's glove already. So what's the latest feature for this one?
Latest features, we give more of the the low weight of the device, and also with more safer, and also with the smoother of the electricity distribute to the patients, and also our system. This is when compared to the device from another country, it seems to be lower in the price.
I like that. So with all that being said, so how do you install this? I mean, is it like one size fit all? Can you show us how it works, please?
Because the device is can be adjustable. So that's why if people have the shakings and they would like to try the glove, they can use the glove and then they can adjust the glove according to their hand to the size. Yes. The glove have the components of the 2 components right now. This is the control box, and this is a mobile phone, and this is the electrical muscle stimulation surface.
The monitor.
Patient. Yeah, that's right. And these are connections through the Bluetooth.
Good.
Yeah, and another good thing is because this is the control box. Because as I mentioned to you, if Parkinson's disease patient, they have the shaking. So and if you use the electrical muscle stimulation to stimulate on the hand muscle, that might be helpful to lower the shaking. Okay. So that's why this device have combined of the 2 modules. The first module, this is the tremor detection module with the gyroscope and accelerometer to detect the shakings on the patient's hand and to determine how frequency of the shaking is.
So as Dr. Onanong is moving the device, if the camera could see that
the frequency
is kind of changing as well.
Yeah, that's right. Yeah, this is like a real-time result. Okay, and also if patients have the shakings, because at this time from the medical knowledge, we know that different types of the disease for the tremor, they have different frequency as well. So that's why this time, if patients have the slow frequency tremor at rest, the tremor detection module will check, and then they will analyze for the data that this shaking pattern is fit to the Parkinsonian tremor. So that's why they will allow the system to extend the electrical muscle stimulations in the safe zone of the level to the patient's hand.
Right, and these data will be recorded and sent to you once the patients come to visit.
Yeah, that's right.
2 in 1.
Yeah, that's right. And also the data, once patients would like to use this device at home, they can upload the data at the end of the day because the data will go up into the cloud.
Oh, nice. So can you throw me some numbers of how much this will cost?
Usually right now it's around 30,000 Thai baht.
Can we just buy it, or do you have to wait for a doctor's prescription, or how does it work?
Due to this is very good thing of this study because we get supported from many sources, especially from the Chulalongkorn University, and also we get the funding resources from the TED Fund in the past 3 years to conduct the commercialize of this device into the more of to become the true business. And also the last year we got the Thai Innovations Award 2022. So that's why this is all the support to make this device to become as a commercial product. But by the way, we think that if patients would like to use this device in our mostly right now this device still can be available in our center. But by the way, if patients from another hospital would like to try the device, and we also welcome to have some patients that have the shakings and would like to try for the tremor growth that have the good enough to treat the symptoms or not.
So basically you could kind of purchase it, but you could borrow it as well.
Yeah, that's right.
Nice.
Because at this time, due to we are the governmental hospital, so that's why we prefer to use donations model to the patients. So if most of the patients with Parkinson's disease, we believe that due to the cost of the medication or treatments is quite high. So if we can be able to help them with some of the devices that may be helpful, we plan to offer them as without any charge. But by the way, we get some of the people who would like to donate money to support this study.
Now the people at home may be wondering, how long do we have to wear this glove before the tremors just go away?
Honestly, due to at this time, even though patients taking oral medication, the tremor usually not gone away. Even the gold standard of the treatment still have the shaking or the tremor. So if patient would like to get up to 80 to 100% of the tremor reduction, they need to do the brain surgery. But our system can give another benefit to add on treatments to the oral medication around 30% to 50% additional to the oral medication. But by the way, due to this is the system that didn't make the direct of the change into the brain as the brain surgery. So that's why it cannot do completely 100% as the brain surgery did.
And results.
Yeah,
so what's the feedback from the users?
Because in the past we have many of people in our center can try about this device, and especially at the time of COVID infection in the past 2 years, because in the situation of the lockdown, many people cannot go to the hospital. This device have used to help people a lot, and also with the patient, because we send this device for the patient, and they can use this device at the same time to check about their movement and the shaking at the same time. So that's why at the time that even patient didn't come to the hospital, but we are be able to help them to adjust the oral medications for them.
Because the information is sent to you.
Yes. And also at the time that patients still have the match with the doctor in the center, we can do the teleconference and using the data that we get from this device to more information to help the doctor to adjust the medications to help patient symptoms.
So let me get this straight. This device, this Parkinson glove, not only helps with the tremor, also detects the symptoms of the patients, which uploads it up to the cloud, gives it to the doctor to adjust their medication. It's free of charge, one size fits all. I mean, this is perfect already, but this is Chula Innovations Unlocked. We want to take everything to the next step. So my question is, what is your next step of R&D for Parkinson Club?
In my opinion, at this time, I think our system, this is quite ready to become more bigger and larger scales. And in the past, we got fundings from the TED funds into the productions, into the commercialized level. But we still need more and more of the good enterprise or the good of entrepreneur to support that into develop this device into the next step of the commercial level.
I see.
Because I think that the good thing of the device is if it can be able to reduce the size more.
Smaller.
The smaller and become like a lightweight. And
Can I try it?
Actually this is lightweight, but
not too heavy.
Yeah, but we would like a more lighter than this. Yes, and some of my patients, they think that it seems to be like still be like the medical device. So some of my patients, they said this is possible to adjust this size to be like the garments or the
design.
watch. They need to change for the design. So that's why this is might be another level of the development that we might be consider.
Right. They say money's not a problem,
Yeah.
but not having money is a big problem. Right. Now, is it true, Dr. Onanong, is it true that in Thailand, for every 100 senior citizen, one is a Parkinson's disease patient?
Actually, this is true.
Wow.
Yeah, and even if you see that for the 100 people who the age of more than 85, you might be found 5 people with Parkinson's disease. Yes.
Wow. Because the statistics that we found that was based on 60 onwards is 1%.
Yeah, that's right. So because of this kind of the degenerative disease, so if you found the people who getting more older, the older people might have more of the degenerative disease, including the Parkinson's disease, and not only Parkinson's disease, might have the Alzheimer's disease, something like that. So that's why once the age is more getting older, people might have more and more of the numbers of the disease, and also with the more of the severity.
And with Thailand becoming an aging society, so we can expect quite a bit more Parkinson's patients.
Yes, right now, because in Thailand, we expected that the Parkinson's disease people in Thailand probably may be around 150,000 people in Thailand, and the total of Parkinson's disease people in the world is around 10 million.
If we truly believe that prevention is better than cure, as an expert in this field, what would be your advice to the audience? And especially, how they should be changing their behavior so that they could stay away from Parkinson's disease as much as they can.
Actually, right now, so we know that the Parkinson's disease is not cured.
Ouch.
So that's why. But by the way, if we can be able to detect for the people who might affected or to be at risk of the Parkinson's disease, that would be very nice.
Okay.
To provide some of the intervention that might be very helpful to them. And at this time, we found that once the patient was diagnosed of the Parkinson's disease, these kinds of the patients might have some of the symptoms that occur beyond the onset of the Parkinson's disease diagnosis.
Okay.
And we found these kinds of symptoms we call the prodromal symptoms.
Okay.
And prodromal symptoms can be occur to the patients might be up into the 5 year or up to 10 year for people who have the Parkinson's disease in the future.
Okay.
So that's why this kind of the prodromal symptom, at this time we have the 4 prodromal symptoms.
Okay.
The first thing is about the constipation. The second thing is about the REM sleep behavioral disorder. This is the problem with the sleep or the sleep enactment.
Okay.
And the third thing is about the anosmia. The patients have the lack of the sense of smell or decrease in the sense of smell.
Okay.
And the fourth thing is about the depressions. Elderly people might have the potential to be the prodromal disease or the Parkinson's disease, and they might have the Parkinson's disease in the future. And this time we found that if the patient would like to stay away from the Parkinson's disease and also with the neurodegenerative disorder, do the good exercise.
All right.
You eat the good food, and also you have the less of the anxiety and the good sleep. That might be very helpful.
Right. What kind of food should we go with?
Yeah, right now we have the recommend patients to eat the Mediterranean diet.
Mediterranean diet.
Try Mediterranean diet before.
I can think of olives.
Because the Mediterranean diet, this is the pattern styles of the eating in the Mediterranean basins border, especially for the Italy, Greece, France, something like that. And we found that these kinds of the people in that area, they have the less tendency to have the vascular disease, especially the heart disease, and also have the low prevalence of the patients who have the neurodegenerative disease, such as the Parkinson's disease and also with the Alzheimer. Yeah, so that's why we think about that the Mediterranean diet, they might have the good potential to become as the preventions for the Parkinson's disease.
Okay.
But by the way, if I ask you, you need to try the Mediterranean diet and you need to adhere with the Mediterranean diet. You think this is very difficult for you?
It's got to be hard to access, I would say.
Yeah, that's right. But so right now we found that in our center, we think that if we would like the Thai people to adjust their lifestyle or the eating into the Mediterranean diet, this is quite be very difficult.
Yes.
So that's why we try to adjust the Mediterranean diet into the Thai style.
Into Thai food?
Yeah, into Thai food to make patients more easier to follow or to adhere to these types of the eating.
So how does one simply adjust Mediterranean diet into Thai cuisine?
The first thing is you need the protein.
Okay.
Is that correct?
Yeah.
Okay. Which type of protein or the meat that you like?
I enjoy chicken.
Oh, your chicken, that is very nice because the Mediterranean diet, they prefer chicken and seafood. And they try to avoid red meat and pork.
All right, pork and beef.
And also for the cooking oils, which types of the cooking oils you use usually in your kitchen?
In my kitchen, we go with rice bran.
Rice bran oils, okay. But because most of the Thai cooking oils, we usually like vegetable oils,
Palm
the rice
oil.
bran oil, palm oil, and also with the lard or the oils from the animals,
Okay.
from like a skin of the chickens and for the pork. So that's why if we can be able to adjust into the olive oil.
Olive oil.
Yeah, that would be
okay.
much easier to get more of the standards of the Mediterranean diet.
Okay, we can start with that. Chicken,
Yeah.
olive oil.
Yes, and also try to increase the amounts of the vegetables and also with the fruit, and try to eat less of the milk and also with dairy products.
Oh.
Yes,
Okay.
that's it. This is the core of the Mediterranean diet. So it is
Okay.
very easy. And if you are to drink some of the alcohol, please try the red wine.
Red wine.
Yeah, but not too much.
Not too much.
Not too much. Yes.
All right, otherwise it'll be too much of a good thing. I'll remember that. Chicken and olive oil. All right.
And also at this time, due to we believe that to starting of the eating with the good food with the Mediterranean, it is quite big. Difficult. So that's why our center, we recruit for the numbers of the medical professionals and also who have the talents in the kitchen,
Okay.
in the cookings, and also to make in the group of the cookings, like a cooking studio.
Okay.
And we call this is a Chula PD cooking studio.
PD cooking.
Yeah, so our cooking studio is targeted to do the cookings for the in the Mediterranean style,
Okay.
and in the Thai style Mediterranean diet,
Okay.
to support the patients, and also we will invite the patients or welcome the patients to join our group to change their lifestyle of the eating pattern into more of the healthier way.
Wow.
Yes.
Okay, so the details are pretty much here, as you can see.
Yeah.
Right, so just make sure you get in there and hit the like button and follow.
Yeah.
Right. I mean, with the aging society pretty much knocking at the door, if not here already, it's going to be quite a big challenge for you and the kind people here at Chulalongkorn University to fight with Parkinson's disease. And I wish you the best, and hopefully one day soon enough find a cure for this. All right. Thank you so much for your time, Dr. Onanong. ขอบคุณครับ
Thank you ค่ะ สวัสดีค่ะ
Chula Innovations Unlocked is produced and presented by Super John Klinsawan. This program is brought to you by Chulalongkorn University.